in a healthcare system built by men for men. The drugs, devices, technology, and products that we use every day for our health and wellness needs have usually been tested on men with very little representation of women in these clinical trials. Most drugs are prescribed to women and men at the same dose. We use apps for tracking our menstrual health or fertility cycles that are designed by men from the male point of view. But do we have the same way of thinking? Do we have the same bodies? Are we the same physically, emotionally, psychologically, and physiologically? We are not. A large part of my work is to create a zero vision world and moving towards a concept of innovating to zero. What does this really mean? In healthcare, it means building a world where there is zero bias, zero gender equity, zero disease, zero pandemics, zero infections. It could also mean, especially in these times, zero war and zero poverty. Breaking the bias for me means building a woman-centered healthcare system, women-only trials, increasing female representation among researchers, inventors, investors, venture capitalists, and founders, who in turn can create a much more women-centered product and solution base that recognize and target women-specific healthcare needs and eventually achieve a society that is healthy and a community that is safe. Thank you so much.
My name is Karen Busen, and I am the Director of International Clinical Support for OBIX Middle East. The question was posed to me, what does breaking the bias in nursing mean to me? Well, I've been a labor nurse for over 35 years, so in my career, it might have been as simple as not jumping up out of my seat when a physician entered into the nurses station. And I loved it the first time a doctor told me, Karen, you don't need to jump up every time I walk in the nurses station, you know. And so I think that was a big leap, but I do know that for most doctors, professional respect for nursing was not fashionable in the past. We were considered handmaidens, if you will. And I think especially through the years, and then especially since the pandemic, I feel like doctors have learned to respect nurses and their abilities and make a better care team because of that. So during the pandemic, if you think about it, the nurses were predominantly the ones on the front line. They were the ones spending hours and hours with COVID positive patients. They were the ones putting their lives at risk. And I believe that from that, not only from the public, but also the government and physicians and really everyone really understood the value of nurses. And we should celebrate that, and we should respect our nurses. And you know, we need to keep them at that bedside. I think nurses are proud to call themselves nurses now. And we are not handmaidens any longer. And sometimes I still feel like there's that perceived thought that nurses are subservient to the doctors, but it's really a collaborative effort and a shared mental model, if you will, when we're on the nursing unit, whether it's in obstetrics or anywhere else, of being a team for that patient to improve patient safety. So I think too, something else I wanted to address during this interview was just nurse leadership. So nurse leadership has always supported their nurses, but since the pandemic, they have really stepped up in terms of supporting their nurses. We have issues that need to be addressed. We have nurse burnout. We have PTSD from the pandemic. We have nurses leaving our profession in droves, and we need to address those issues, right? So advanced leadership certainly has stepped in to help their staff and acknowledge them for all that they have accomplished. They try to celebrate their successes, certainly. We have also had to make sure that we're addressing their well-being and providing them counseling and things that they need to address that well-being that they so desperately need, as well as self-care for the leadership as well. Nurse leadership needs to constantly reassess our priorities and provide purposeful and meaningful and direction to the staff. And things change so quickly, especially during the pandemic, and even coming out of the pandemic now. How do we continue to address COVID-19 in the future? So that's something that's very important. What about the backlog of pause services that we've had, elective surgeries and things like that, that we haven't been able to take care of because of our COVID patients? And so we need to consider how we can improve those services and avoid continued burnout and moral distress of our nurses. So let's continue that, so important communication and trust among all caretakers. I always think too, how can we learn from what's happened? So how can we take what we've learned and provide safety information and recommendations, not only to staff, but to government and to the community, and improve equitable and integrated care and emergency services globally? We have to be prepared for maybe another emergency like this in the future. So I really feel like if we work together, we can create a world that is diverse, equitable, and inclusive. A world where difference is valued and celebrated and respected. And I think collectively we can break the bias. Thank you.
Bismillahirrahmanirrahim. Hello everyone and assalamu alaikum. Today, in celebration of International Women's Day, I thought what would be the best way to express how I address the theme that is for this year, which is breaking the bias. And what's interesting is that breaking the bias does not pertain to females alone. It pertains to everyone around the world. And the first thing that came to my mind thinking about the theme of this year was the following, was actually a holy verse from the Quran. O mankind, we've made you into nations and tribes so that you may get to know one another. And the noblest amongst you in the sight of God is the one who's righteous. Another message that came to me was the speech that our Prophet Muhammad ﷺ said in his final pilgrimage. He said, all humans are descended from Adam and Eve. There's no superiority of an Arab over a non-Arab or of a non-Arab over an Arab, and no superiority of a white person over a black person or of a black person over a white person, except on the personal basis of piety and righteousness. Taking this theme and this message a step further today in terms of equality and in terms of equal opportunity for females, my vision for a beautiful society that lives in harmony is one where everyone from every race, ethnicity, culture, religion, background, and gender is able to live amongst one another in harmony, producing mixed teams where females are equally represented in every step of the way and given equal opportunities to grow and to succeed. And that beautiful harmony will create more creativity, innovation, and this new future that we're living in this world and day and age. Thank you.
Hi everybody, my name is Samad Nassar. I've been in the healthcare industry for almost 20 years now, and I want to share my thoughts on breaking the glass ceiling and the biases for women in leadership, specifically in the healthcare industry. I want to share with you 4 takeaways or notes that I hope it will resonate with you. Number 1 is you have to believe in yourself. And I want to share with you an example that I hope it will inspire you. So more than 15 years ago, I saw an ad on Bait.com. LinkedIn didn't exist at that time. And it read, we're looking for a male medical representative. I looked at the job description and the thought that came to me was, I can do this. And I applied for it and I got the job. This was my entry into the industry when I was a product specialist or a sales rep working for Johnson & Johnson Medical in the western part of Saudi Arabia. You, of course, have to have what it takes to perform to your highest and your best ability, doing the job and focusing on the scope that has been assigned to you. The second thing that I want to share with you is that you have to be crystal clear on your purpose. The clarity of purpose will help you excel and do more. And you could see that they both intersect. So you need to think, what does ignite my soul, and what was I brought into the world to do? Like I always say, I was designed to do this. I was meant to do this. The third one, and again, it goes hand in hand with number 1 and 2, is having the right sponsors and people that will believe in you. And I was very fortunate to have these sponsors across my journey. And again, it gave me a lot of room to express myself and excel along my path and journey. And the last one is you need to be careful with where do you invest your energy. And if you don't have the clarity of your purpose, and if you didn't know whether you could do it or not, then your energy would be wasted. So again, they all intersect together, and I would say that these 4 things have really came out to me along my journey. And they got me to where I am today, 20 years later. And I'm very happy to share these lessons and takeaways with you. I hope they resonate with you. I want to wish you all a very happy Women's Day, not just today, every day, to all my sisters, colleagues, mentors, and friends out there. Have a great day. Thank you.